Hello students, welcome to our channel, Education Level. In today's video, we are going to discuss a very important topic, kidney transplant. The kidneys are vital organs in our body that filter the blood, remove waste products and excess fluids, and maintain the body's electrolyte balance. However, sometimes the kidneys get damaged or completely fail, a condition known as end-stage renal disease, ESRD. For such patients, dialysis provides a temporary solution, but the permanent solution is a kidney transplant. In this video, we will cover in detail what a kidney transplant is and why it is performed, the donor and recipient selection process, step-by-step procedure of the transplant surgery, problems associated with kidney transplant. This video will give you a complete understanding of how the kidney transplant process works and its impact on a patient's life. So let's get started and explore kidney transplant in detail. First of all, we discuss what is kidney transplant in simple words common man can understand. A kidney transplant is a medical surgery in which a healthy kidney from a donor is placed into a person whose own kidneys no longer work properly. This is an operation or surgery where a person with failing kidneys receives a working kidney from someone else so their body can function normally again. Why is a kidney transplant performed? For what reason is a kidney transplant done? A kidney transplant is done when a person's kidneys are badly damaged and cannot clean the blood or keep the body healthy. In simple words, when the kidneys stop working properly and cannot remove waste from the blood, a kidney transplant is needed. After a successful kidney transplant, most patients, 1. Feel more energetic. This means the patient has more energy, feels less tired, can do daily activities more easily. 2. Can eat a more normal diet. This means the patient has more food choices. They do not need to avoid many foods. They can eat foods similar to healthy people. Their diet is less strict and less limited. 3. Have fewer restrictions in daily life. This means the patient has more freedom, fewer limits on daily activities, can work, travel, and live more normally. A transplanted kidney helps to remove waste from the blood, maintain proper fluid balance in the body, control blood pressure, support red blood cell production. Now we will move on to the donor and recipient selection process. This means selecting a healthy person, called a donor, who can give a kidney to someone in need. The donor and recipient selection process is how doctors choose the right donor and the right patient for a kidney transplant. Doctors carefully check both the donor and the recipient to make sure the donor's kidney is healthy, the donor and recipient have compatible blood types, both are medically and physically fit for surgery. This process is very important to make sure that the transplant is safe, the new kidney works properly, and the risk of rejection is as low as possible. So far, we've gone over the donor and recipient selection process. Now let's walk through the step-by-step procedure of a kidney transplant surgery. Step 1. Pre-surgery preparation. The patient is admitted to the hospital. Blood tests, imaging, and final compatibility checks are done. Then, the patient is given general anesthesia. This means they are completely asleep during the surgery. Step 2. Donor kidney preparation. The healthy kidney is carefully removed from the donor. It is preserved in a special cold solution to keep it safe and healthy until it's ready to be transplanted. Step 3. Surgical incision. The surgeon makes an incision in the lower abdomen of the recipient. A surgeon is a doctor who performs operations. Usually, the patient's old kidneys are left in place, unless there's a medical reason to remove them. Step 4. Placing the new kidney. The donor kidney is placed in the pelvic area of the lower abdomen. This location allows easy access to blood vessels and the bladder. Step 5. Connecting blood vessels. The kidney's artery and vein are connected to the recipient's blood vessels. Once blood starts flowing into the new kidney, it often begins producing urine immediately or shortly after. Step 6. Connecting the ureter. The ureter from the donor kidney is connected to the recipient's bladder. This allows urine to pass normally into the bladder. Step 7. Checking kidney function. The surgical team carefully checks blood flow and urine output. Any bleeding is controlled to ensure safety. Step 8. Closing the incision. The incision is closed with stitches or staples. A sterile dressing is applied to protect the area. Step 9. Post-surgery monitoring. The patient is moved to the recovery area or ICU. Doctors and nurses closely monitor kidney function, urine output, and vital signs. Step 10. Recovery phase. The hospital stay usually lasts 5 to 10 days. Regular follow-ups and lifelong medications are required to make sure the kidney continues to function properly. So, this is all about step-by-step procedure of kidney transplant. Now we will move towards problem associated with kidney transplant. Means the difficulties, risks, or issues that can happen when someone gets a kidney transplant. Sometimes the body does not accept the new kidney and it gets damaged. Lifelong medicines are needed. To save the kidney, medicines have to be taken daily. Risk of infection. Because of the medicines, immunity decreases and diseases can occur quickly. Side effects of medicines, like sugar, diabetes, BP, weight gain, weakness. Problems of the operation. Bleeding, pain, or infection can occur. Kidney may not work immediately. Sometimes the kidney starts working slowly. High cost. The operation and medicines are expensive. So, this is all about kidney transplant. If you like my video, please don't forget like, share, and subscribe.